What is length time bias? Have you ever wondered how certain biases can affect our understanding of diseases like Parkinson's? One such bias is called length time bias. This is a type of selection bias that often comes into play during screening studies, especially for chronic diseases. Length time bias occurs because screening tests tend to identify diseases that progress slowly. These slower progressing conditions are present for a longer time, giving them a higher chance of being detected during screening. On the other hand, rapidly progressing diseases, like some forms of cancer, are less likely to be caught by screening since they develop and show symptoms much faster. This bias can lead to an overestimation of survival time for cases detected through screening. For example, if a screening test picks up more slowly progressing tumors than those that grow quickly, the survival statistics for these screen-detected cases may look better than they truly are. This happens because the slowly progressing tumors naturally have a better prognosis, regardless of how effective any treatment might be. Now, you might be thinking, how does this relate to Parkinson's disease? While Parkinson's is not typically screened in the same way as cancers, understanding length time bias can still shed light on the challenges faced in evaluating disease progression and treatment outcomes in chronic conditions like Parkinson's. It emphasizes the need to consider the natural history of diseases when interpreting diagnostic data. To prevent length time bias, researchers often use randomized controlled trials. In these trials, participants are randomly assigned to either a screening group or a non-screening group. By comparing outcomes across both groups, researchers can ensure that the results reflected the true impact of screening, rather than the biases that come from how diseases are detected. Focusing on mortality rates instead of survival rates can help researchers better assess the effectiveness of screening programs and avoid the distortions caused by length time bias. In the context of Parkinson's disease, recognizing this bias is crucial for researchers and clinicians. It helps them appreciate the complexities involved in diagnosing and treating chronic conditions. Understanding length time bias can ultimately lead to better research practices and improved patient outcomes. Always remember, if you have questions about Parkinson's or any health concerns, consulting a healthcare professional is the best course of action.